this EPI-WIN is being recorded. You might have just heard that. We would love to hear from you. So please, as always, put your name and where you're from and what you do in the chat box. But if you have questions, please put it in the Q&A box, because that's where we can see your questions and respond to it immediately. We request all of you to provide any insights and comments you have in the chat. We'd love to hear from you and your experiences. But please keep your comments respectful and focused on this topic. Anyone who is disrespectful in any way will be taken off the webinar. But we hope to have a very interesting experience sharing conversation with you. So please do share your experiences. We'll just wait a few more minutes to for more people to join, and then I will hand over to Dr. Kai von Harbu.
They started the session now, but the recording is in pause.
But just wait a few minutes for everyone to join. I'll go over the housekeeping.
Charline, s'il vous plaît, c'est l'interprète. Nous ne sommes toujours pas affectés en tant qu'interprète. On ne peut pas travailler. Over. This is Céline. This is Céline speaking. I apologize for interrupting. I'm team lead for the interpretation team. We still haven't been assigned as interpreters, therefore we cannot work. I've asked the technician to please assign us as interpreters. Over.
I'll tell the interpreters.
I will now.
Priya, can you hear me?
Interpreters, you will be in your booth soon. For all participants, we do have interpretation in French. It's slightly delayed due to a technical glitch on our part. Please be patient with sorting it out. Interpreters, we've requested the technician and you will be in your booth soon. We will, in the meantime, continue with the initial part of this webinar, just the introductions and all of that. Thank you. So welcome once again to all the participants. We'll quickly have a Slido as usual to hear from you. Can you see my screen? Please tell us about yourself. Today, we'd like to know what country you're from. I know you've come from all parts of the world. So join us at slido.com, #1442066, which is slido.com, #1442066. Please do let us know where you're from. Oh, wonderful. We have Barbados, Indonesia, Canada, Philippines, Netherlands, Japan as well. Thank you for joining this late. That's wonderful. Especially those of you from where it's late at night or very early in the morning. You can see Australia, Japan. Thank you. That's fantastic. I will leave this on, the Slido on, so please continue to let us know where you're from. But in the interest of time now, I will hand over the floor to my colleague, Dr. Hartman. Over to you, Kai.
Yes, thank you very much, Supriya, and welcome everyone. And thank you for taking the time to join us for this very important special EPI-WIN webinar for the official launch of the WHO guidance on ethical considerations for social listening and infodemic management for public health emergencies. This is a critical guidance developed through extensive collaboration across WHO's Health Emergencies Program, the Science Division, and a global panel of experts and advisors, as we have seen in many emergencies, including in particular the COVID-19 pandemic, but also in outbreaks such as Mpox, Ebola, and cholera. Managing an infodemic and overabundance of information, including false or misleading content, is not a side concern. It is central to effective response and maintaining community trust. This new guidance provides a clear ethical framework to help health authorities, researchers, and practitioners to engage in social listening that is responsible, respectful, and protective of communities. We are joined today by an excellent panel who will guide us through the why, how, and what of this new resource. Let's begin with our first speaker. Unfortunately, Dr. Chikwe Iekweazu is unable to join us today due to unforeseen circumstances. In his place, I'm pleased to welcome Dr. Nedret Emiroglu, Director of WHO's Health Emergency Core Capabilities Department, who will speak on his behalf and then continue with their own reflections. Dr. Emiroglu, over to you.
Thank you very much. Thanks, Guy, and apologies on behalf of Deputy Executive Director, Dr. Chikwe Iekweazu, who is also acting Regional Director in African region of WHO. He has been pulled into a very important, urgent meeting, and he wanted me to deliver his message. So I'm reading that. And after that, I will give a few reflections for myself. So good morning, good afternoon, and good evening to all joining us. It's a pleasure to welcome you to this important launch event for WHO's new guidance, social listening in infodemic management, ethical considerations for public health emergency. This guidance comes in direct response to strong demand from member states for practical tools to help navigate the complex ethical challenges that arise when using social listening in public health emergencies. Social listening has become a vital function in emergency response. During COVID-19 and other recent crises, we have seen how quickly misinformation can spread and how deeply it can impact public trust, behavior, and outcomes. Understanding public concerns and narratives in real time helps us shape more effective and inclusive responses. But with these tools come responsibilities. This guidance helps ensure that social listening is not only effective, but also aligned with core public health values, like protecting the privacy, ensuring transparency, and avoiding harm. It reflects WHO's commitment to combining the best of science, ethics, and practical experience to support countries in managing health emergencies in ways that protect both lives and rights. This document will help member states, partners, and public health actors around the world integrate ethical principles into their social listening and communication strategies, whether online or offline. Ethical approaches are not only the right thing to do, they also make our responses stronger. Trust is a foundation of public health, and this guidance helps us build and sustain that trust. Thanks to you all who contributed to this work. We look forward to continued collaboration to ensure that social listening empowers communities and strengthens our collective response to future emergencies. And I look forward to the discussions ahead. Actually, Chikwe has been conveying many of the messages that are critical for our discussion today. So let me add a bit of a different perspective, I will say, because actually the launch of this guidance is a milestone for us. And it is within the work we do in health emergencies on protecting the communities and the working together with the communities for resilience in public health emergencies. So we have a core and powerful principle within the community protection. It is not that we just convey the messages to the communities, and on the contrary, they are co-leading, co-creating, and they are the active partners in their own health and safety. So that's a major mindset change, and actually that puts communities at the very center. And as we have learned from many emergencies, communities are extremely vulnerable to misinformation. They can fear, they can maybe reject some of the important medical countermeasures or public health and social measures, and they get confused to be able to protect their health. So social listening actually helps us, the whole global public health environment, understand what people are experiencing in real life. Are they fearing? Are they accepting? Are there different ways to approach them? How could we also work together with them so that they decide and take the best decision for their health and safety? But at the same time, we have to understand that social listening is a huge responsibility if we're going to define our major policies, strategies, actions in that. It can do harm if it is not done with the ethical care, and it can reinforce the stigma or erode trust, which is the worst thing that could happen in working with the communities, or sometimes it excludes those who most need to be heard. And providing the guidance and leadership in this normative work is actually WHO's mandate. So I'm very happy that this is a work led by WHO, bringing multiple different technical departments and divisions together, and you will hear from them. But at the same time, it opens to a broad consultative process, building upon academia, the scientific experts, and all relevant stakeholders and authorities. So I would like to have a quote from the actually document. It says, Ethical social listening is a component of ethical public health action, which I fully agree. That means that we listen, how we listen reflects actually how we value the people we serve and how we work together with them. So in a summary, it builds the community's trust and safety. It's built upon the respect and protects individual rights during insight gatherings. And it also ensures that the communities understand how and why their voices are being heard. So the document identifies the clear ethical boundaries to prevent data misuse or harm. And also it gives the major target of amplifying diverse voices, especially from marginalized and underserved communities. So I'm really looking forward to today's discussions, and please feel free to comment and try to make it as interactive as possible. And I would conclude here by thanking WHO teams who work jointly in, but also to the expert group and all the stakeholders that have contributed to this important work. Thank you very much. Back to you, Kai.
Thank you very much, Nedret, for providing this very important context to our work on community protection and for highlighting in particular the importance of ethical engagement with communities, which is a core component, of course, of our work, and is also very strongly reflected in this document. Just to let everybody know that interpretation in French is now available, and you can select it through the button below. And also there's a Q&A box, and we ask you to please type in your questions for the Q&A session later in the meeting. Now we come to the next agenda item, and I will start to share a few reflections on the motivations and objectives of this guidance from the perspective of our unit, the Community Protection and Resilience Unit, which I think Dr. Nedret already really outlined very well and mentioned that it's really at the core of this guidance. But I will just highlight a few components of this and then hand over to Dr. Andreas Reis, who's the unit head for ethics and governance unit in the Research for Health department, and who played a leading role in convening the expert group in guiding this work from an ethics perspective. But first, just from my side, as we have heard already, social listening is really an essential part of our response operations across many health emergencies. That includes outbreak, but also includes other types of emergencies, humanitarian emergencies, conflicts, etc. Because it's not only important to identify and track misinformation, but also to understand people's lived realities, their concerns and needs and beliefs. But as with all our response measures, it's really critical that this is done with transparency and with a strong ethical foundation. If we collect insights without ethical safeguards, we risk damaging the trust of the communities. We risk harming vulnerable groups or even deepening existing inequities. And this is why this guidance is so important, to ensure that our listening practices do no harm. This is about building and sustaining trust with communities and ensuring that data use is transparent and responsible. These are very key aspects to this guidance that Dr. Emiroglu already highlighted as well. And our main objective for developing this guidance was that we wanted a resource that is practical, action-oriented, concrete, and grounded in public health realities. That's why we reached out to our colleagues from the Ethics and Governance Unit to propose the collaboration on this important document, and we will hear more about the process later on. And of course, as with all our work, we really want to support governments and health agencies to conduct these activities responsibly and to protect communities, especially those that are already at risk for marginalization. With that framing, I now hand over to Dr. Andreas Reis, who can speak a bit more on the process from the ethics perspective. Over to you, Dr. Reis.
Thank you very much, Dr. von Harbour, not only for your remarks, but also for the excellent collaboration between our two WHO units on this topic. And I would also like to give a special thanks to the rapporteurs of our expert group, Professor Nicola Billa-Andorno, Giovanni Spitale, and Federico Germani from our WHO Collaborating Center for Bioethics in Zurich, as well as to our WHO expert group, which was led by the two co-chairs, Calvin Ho and Isabella Ballarai. So a big thanks to all of these colleagues who made this work possible. I think rumors and misinformation about health and medicine are probably as old as humanity. But the COVID-19 pandemic has really brought fake news, misinformation, disinformation to completely new levels. And this is mainly through the use of social media. And in our societies worldwide, we have seen an unprecedented erosion of trust in science and public health. As we all know, trust is very hard to earn, but very easily lost. And only when the public is convinced that public health actions are in line with ethical standards and protect people's rights, the trust of the people can be earned and maintained. This is why it's not only essential for WHO as an organization, but also for national public health agencies to ensure that their policies and practices rest on solid ethical foundations. Social listening and infodemic management are no exception. Only when the public can be assured and is convinced that these key public health actions are carried out in line with ethical principles, they will be acceptable and successful. This is why our Ethics and Governance Unit believes that this document will be really key for all health agencies engaged in infodemic management in moving forward. And with this, I'll hand it back to Dr. von Harbour. Thank you.
Thank you very much, Dr. Reis. And now let's dive deeper into how the document was structured and developed. And I'm pleased to invite Professor Nicola Billa-Andorno, Director of the Institute of Biomedical Ethics at the University of Zurich, and one of the lead writers of the guidance. Nicola will walk us through the document structure, evidence-based, and writing process. Over to you.
Well, thanks so much. I'll be happy to provide you with a high-level overview of the guidance document, its development, the architecture, some key comments. I'm happy to touch Federico Germani and Giovanni Spitale, members of my team at the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, who've played a key role in the day-to-day implementation of this project and who are present in the audience today and can also answer any questions about methodological details you may have. When we started out, it was quite clear that we wanted this work to rely on solid evidence. So a systematic scoping review was done in the very beginning of this work, which had the objective of mapping out the current state of ethical issues in social listening and infodemic management. And the outcomes of this review directly informed and validated the discussions and efforts of the expert group contributing to the content of this guidance document. And it's important to note that the expert group included people on the ground who were involved, for instance, in COVID info management projects, because I think Kai von Harbour just made the point that if you develop guidance, of course, you really want to address real life challenges. So we very much went back and forth between developing the search question for the scientific endeavor, the scoping review, and the work of the expert group to ensure we were really relating it to issues that are relevant to people who are working on the ground. And our expert group continued to be involved in the design of the review and its interpretation. And in addition, there was an extensive outreach. There were extensive outreach and engagement activities with key stakeholders that helped further refine the contents. You'll find a list of those activities in the guidance document itself. Now, for the systematic scoping review, the search strategy was developed iteratively by expanding the original query with text-mined keywords, which were then expanded further and validated by the expert group. And the focus of the search strategy was journal articles, explicitly or implicitly mentioned infodemics, infodemic management or social listening in the context of a public health emergency, and the ethical aspects of infodemic management and social listening. And you may notice we had to include a little workaround because we wanted to include literature from 2002 to 2022, but the term infodemic was really coined during the pandemic. So we had to use terms that were also used earlier and worked quite extensively back and forth with the expert group to ensure we were really also capturing the relevant terminology and scientific contributions before the COVID pandemic. The queries were then run on 3 major databases, PubMed, Web of Science, and Scopus, and the resulting entries were complemented with additional material identified by the expert group, in particular the WHO and United Nations policy documents that pertained to the topic. And overall, we ended up, as you can see to the left, with 103 studies that we included in the review. The review has already resulted in a publication that you can certainly look at online. It revealed some important insights, we think, concerning the ethical issues and standards in social listening in infodemic management, and some core principles such as community engagement, empowerment through education, inclusiveness and fairness, which are all vital in improving the impact and efficiency of communication and social listening activities. And it confirmed that ethical practices are essential to augment the effectiveness of social listening in infodemic management during and in preparation of health emergencies. And you may not be surprised that this is the case because you all know infodemic management is a non-trivial task. You're trying to juggle a lot of things at once. You want your intervention to be effective. You want to avoid harm to the population caused by misinformation, disinformation, right? And at the same time, you want to maintain people's autonomy and privacy as much as possible. And you want no parts of a population to be burdened unfairly by certain interventions or to be exposed unfairly to certain harms from maybe with holding back from an intervention. So all of this is fairly delicate to figure out. And there are thus a number of issues that arise from this tension, such as the vulnerability of individuals and communities, active and passive freedom of information, trust, transparency, and trustworthiness, etc. And this is why we wanted this guidance document to really help navigate the tensions, to really be able to strike a balance. And we wanted to do so by guiding organizations and individuals seeking advice on how to ethically engage in social listening in coordination with the protection and respect for human rights as part of an infodemic management protocol, so really in a systematic, very hands-on, very practical way before and also during health emergencies. So that was really the ambition of the document, and you can now see the structure of the document. It starts out with the challenges detailing complexities and issues that make infodemic management ethically difficult. It then continues with a section that shows how we can ensure that interventions respect and uphold individual rights, freedoms, and values. It then proceeds to some substantive principles, the ethical foundation of the framework, and then importantly comes to some procedural principles that are actionable targets with tangible practical implications, and then finally closes with a roadmap of how to direct this really quite concrete, quite actionable, ensuring a cohesive and effective approach to infodemic management. Now, starting out with the challenges, and I'll be brief here. I have no chance of reading this long list or even explaining it to you of challenges, but you can see there is a number of serious challenges. Among them, for instance, the erosion of trust that was already mentioned in the introduction. For instance, people that may feel spied upon by social listening teams, or the questions of the place of censorship on social media. And just to say, in times of crisis, it's definitely perilous seas we need to navigate. And to provide an image of that, Giovanni Spitale, member of our rapporteur team, has created this AI-based image to show the perilous waters we're in when dealing with the challenges of infodemic management. When you consult the guidance document, you will find a detailed descriptions of each of these challenges that are listed here. The next section, the section on the alignment with human rights, outlines and explains in a very accessible way how we can ensure that the relevant human rights declaration documents, that is the Universal Declaration of Human Rights, the relevant principles and guidelines on human rights and public health emergencies, and also digital rights are all heeded in this process of designing and deploying public health infodemic management strategies. And then the next step, the substantive principles. You see that list is shorter. Also, I cannot explain each of them now in detail, but you see they act as the guiding lines. They include principles such as transparency or a common good orientation, meaning that social listening in infodemic management should be able to be justified as being for the good of all. And again, you will find a detailed description in the guidance document itself. The next step, the procedural principles, which we consider an important part of the guidance, they help to show the way to the implementation of the substantive principles, so they can act like a little bit of a map, which you see again in this AI-generated picture here to the right. Among them are, for instance, the integration of feedback into the refinement of measures, community engagement, and pursuing the understandability of communication, which is not, as many of you know, again, a trivial task. And now the implementation section, that's the largest section of the guidance document. It aims to help actors shape concrete interventions in an ethically desirable way. And you see this here illustrated by the compass as an image. It addresses the life cycle of interventions from planning to deployment, providing an initial roadmap for ethics by design, infodemic management. And notably, this section also includes some case studies, which we will later, I think, also hear about. Elodie Ho will present one of the talk about one of the case studies that we chose to use in this document to ensure the concrete application becomes readily apparent. And finally, just a brief glimpse into how the systematic approach works. So we've structured the recommended actions in the final section such that they are developed by crossing procedural principles, which you see on the top here, with elements or categories of infodemic management, which is the column to the left. So for instance, you might want to implement privacy concerns. See here, the column next to the left column. And you might want to implement those privacy concerns in an intervention, first line, that monitors and detects narratives, questions, concerns, and misinformation in the information ecosystem. So then the guidance document will provide you with this. And again, no chance of going through this in detail, but just by the way of an example, it might tell you that, you see here in the first paragraph, whenever possible, operate on anonymized data. If not possible, obtain explicit and informed consent from individuals before collecting and using their data for infodemic monitoring and detection. Ensure that they understand the purpose and potential uses of their data. So you see that these recommendations are really quite granular, and this is why we hope they will be helpful for people working in the field. And we're very pleased to have this opportunity to present this work to you. We're very much looking forward to your feedback. Thanks a lot for your attention. I'm handing back over to Kai. Thank you.
Wonderful. Thank you so much, Nicola, for walking us through the process and also the architecture of the guidance and showing us some very practical aspects to it. Just a reminder to please put your questions in the Q&A, and we will also share the link to the document with you very shortly. And now we turn to Dr. David Scales. He's Assistant Professor at Weill Cornell Medical College and Chief Medical Officer of Critica, an NGO working on science communication. David will share insights from his role in the expert group that helped shape the guidance. David, over to you.
Thank you very much. It's an honor to be here and present on behalf of the expert group. I'm just going to give a brief presentation about the process and some highlights. First, I just want to point out the expert group, which had over 20 experts from all WHO regions, included experts from ethics to infodemic management to people working on research on infodemic management. We had a number of objectives: to advise the WHO on developing guidance on ethics matters for social listening and infodemic management in the context of programming, emergency preparedness activities, and emergency response. We were to advise the WHO on developing practical tools to apply guidance for social listening and infodemic management for infodemic managers and implementation researchers who conduct social listening to monitor the infodemic and guide infodemic management interventions. I want to emphasize the importance of the practical tools as part of this guidance document. This is a document that is supposed to be something that can be used as people are setting up and implementing infodemic management. It was to discuss and advise WHO on the ethical considerations in social listening and infodemic management that need further exploration, identifying emergent issues and the application of guidance in the field, and I'll mention a couple of those. And prepare a guidance document, which Dr. Biller Adorno just presented on, that comprises definitions, principles, practical ethical guidance, and implementation tools aimed at providing effective support for infodemic management actions in the context of preventing and responding to health emergencies during public health crises. So the process that the ethical document went through with the expert group was we had monthly plenary meetings from March 2023 to March 2024. And experts were expected to attend those meetings regularly, contribute to discussions, and review and comment on draft materials. We had multiple opportunities to review and comment on all draft materials throughout the process. And we were invited to submit case studies, which Dr. Ho will be presenting after me, to highlight some of the ethical aspects of social listening in practice, again, with the practical orientation of this document. Now, a couple of very brief highlights that I just want to mention, building on what Dr. Biller Adorno mentioned, is that there was a heavy focus on ethical considerations in situations of uncertainty, which in the document is referred to as epistemic underdetermination, which is when there are multiple theories or hypotheses that can explain the same evidence. Now, as this document is focused on public health emergencies, in an emergency, there's clearly a lot of uncertainty and epistemic underdetermination at any given time. And so being able to implement policies and infodemic management despite a high degree of uncertainty is extremely important, and the ethical considerations that need to be considered as that is done was discussed in detail in the document. We also discussed the consideration of potential bias in using AI systems for social listening. AI systems are increasingly being used for the detection and the risk assessment of whether or not pieces of misinformation and other types of rumors, excuse me, are problematic. And so the ethics of using AI systems in this situation is also considered in the document. There was also, with the focus on practical guidance, as Dr. Biller-Adorno mentioned, crossing the procedural principles with elements of infodemic management and case studies are some innovative aspects of this document that go into detail for how practitioners can use this document. That practical guidance, as Dr. Biller-Adorno mentioned, includes the procedural principles as well as the elements of infodemic management. Now, folks with expertise in ethics are probably very familiar with the procedural principles, and folks that have expertise in infodemic management are very familiar with the elements of infodemic management. And crossing these two is where we hope that creates the bridge for practical guidance that will be very useful to those who will be setting up and using infodemic management systems during public health emergencies. And with that, I'll pass that back to you. Thank you very much.
Thank you very much, David, for these very useful insights. And now we want to see a bit more on how we can use this guidance in practice. And for that, we hear a case study from the field presented by Elodie Ho of the African Infodemic Response Alliance, IRA. Over to you, Elodie.
Thank you very much, Kai. So as you said, so this is a case study from Kenya, and the case study in the guideline is from the COVID-19 pandemic experience. Things have changed a little bit since then, but what I'm going to present is really our experience during that time. So what is IRA? So IRA is the Africa Infodemic Response Alliance. This is a regional alliance to really tackle misinformation, disinformation, and improve information ecosystems in general. We were launched in December 2020, and basically that context is right before the COVID-19 vaccines were planned to arrive in Africa and distributed. So there was a lot of information, overload of information, true and false, and a lot of information in between. And basically, our alliance was really mandated to deal with these infodemics. When we started at the regional level, and we chose 5 countries where we were going to pilot the infodemic management approaches. It was very new at that time, so we really wanted to focus our limited resources and energy on a few countries. Kenya is one of them. And the reason why we chose Kenya at that time is for different reasons. The first one is because there's a high internet penetration compared to other countries in sub-Saharan Africa. For example, here you can see that this data is from 2020. 43% of the population has access to internet, which is quite high. There's also a very long experience in the continent, not only in Kenya, to collect information, community engagement, and collect community feedback in the communities. So it was very, very important. And actually it was an opportunity, but also a challenge in terms of infodemic management, because the discipline of infodemic management was very new. So our partners really didn't understand the added value actually of infodemic management compared to community feedback and what they were doing already. But what I can say is, so the landscape, the information landscape has changed very rapidly in Kenya. So with the digitalization of communication, people had access to information from different channels, including internet. And a lot of misinformation that we spotted at that time came from internet, and that was spreading also in communities back and forth, and also communities spreading misinformation on social media too. So it was very important for us to triangulate information from the different sources, but also setting up the system. What is important to remember here is that infodemic management and social listenings are not exactly the same thing. And infodemic management look at the information ecosystem as a broader scope of intervention, where social listening was for us also, and in the different guidelines, the starting point of our intervention. So the first thing is really to understand the conversation, to try to categorize, prioritize, define the tools. And there was nothing at that time. So we really had to design everything, also using what existed already in the different countries. We hired someone who was fully dedicated also in working with the different partners and working on infodemic management, which was a game changer because during that time, if you all remember, we didn't have a lot of time and we had a lot of work to really catch up with the misinformation. So it was kind of a crazy time, and having someone fully paid to work on infodemic management really, really made things move forward. Then how did it work? So for the social listening part, one of the steps that I mentioned before was to create a mechanism, a coordination mechanism. So here you can see on the slide the structure that we set up in Kenya, and also how it works with the different partners, because listening, it involves different partners, including those who are really at the front line of the health emergency. And then when the data comes back to the national level, we had a lot of cleanup, categorization, protection, analysis, prioritization. All these processes basically happen also at the national level. How do we respond? Because infodemic management, once you collect the data, you analyze them, and you understand basically the top priorities and what we need to do. And usually the top priority was the questions. What were the questions circulating in communities and around, the concerns, and then the misinformation, the rumors, and disinformation. So what do you do once you identify that? So one of our key products was actually to respond to it, especially the information gaps with health explainers. So explaining, for example, what the COVID-19 vaccine is, what does it do, the safety, eligibility, and so on and so forth. And we designed, a social media product, which is called Viral Facts Africa. And this is something that benefited the whole community and not just, one agency over another one. And the format is really meant for social media, including WhatsApp. Okay, so here you can have some examples of our products. So you have like person-led explainers, you have infographics, you have text-led. We really tested different formats depending on the target audience and also the performance of those social media assets. So some of the challenges, because there were many, technical and research gaps. The guideline that we are talking about today, the ethical guidelines, didn't exist in 2020. So we had to really navigate also on the different existing mechanisms, and also the lack of methodology or international guideline, let's say. The volume of information was unprecedented. So I think this is one of the top challenge that we had to face, because we really needed to use kind of basic tools sometimes, Excel sheets, to categorize and analyze a lot of data coming from different sources. And it was definitely a big challenge. Lack of coordinated system, processes, and structures. So we work on that with the different partners. Lack of dedicated resources and time, because even though we paid someone to work on infodemic management, all the agencies didn't have that luxury. So who do you talk to? Because you had to borrow time from everybody who was already very busy with the COVID-19 response. There's a key challenge also is about speed versus in-depth analysis. What is good enough? And I think this really resonates with what my colleague said earlier, like striking a balance, because in emergencies, you don't always have the luxury to take time and really analyze everything and make sure that everything is following due process. So we had to make some choices sometimes. And really a balance between collaboration and protection in data management and use, because the whole issue was also the lack of coordination. Infodemics, again, can be too much information. So it was very critical for us to make sure that the others are also aligned in terms of messages and who should speak to who. And with that, we needed to share also the social listening data with the different partners. But we had to restrict access sometimes to make sure that the information data would not be compromised or not misused. So it was really like a negotiation and trying to find a balance between sharing and protecting. And some of the lessons learned. So these lessons apply to infodemic management, but they also apply to social listening, because we tend to believe that social listening is only for data analysts, let's say, which is not the case. And we learned that the hard way too. You need a multidisciplinary team to collect the data, to analyze, to provide recommendations, and also to respond to the data, which is very important. Importance of focusing on building strengthening systems for sustainability. A lot of systems that we put in place during the emergency, some of them disappeared because of the lack of funds, but also because the tools were not necessarily sustainable. Collecting data is a full-time job and it takes a lot of time. So if you don't have processes and also system in place to transfer the knowledge and pay for the people who are going to work on that, unfortunately, the system may disappear. So, and collaboration, I think I covered that. And collaboration, including also with communication specialists, journalists, the education system, because like now the recommendation for all of this is also educate people on how to spot misinformation and inoculate them. And you cannot do that without health literacy. So this is it from my side. Thank you. Back to you, Supriya or Kaya.
Thank you, Elodie. Thank you very much for walking us through this case study. Very, very useful. We now move into our Q&A sessions. And Dr. Andreas Reis has kindly agreed to moderate this session, so I hand over to him.
Thanks. And we have an enormous participation today and a lot of questions, over 20 questions. Unfortunately, I think we'll only have time for a couple, and we cannot answer all of them today. One is actually about the practical guidance and the plan to pilot and or rolling out this tool at a country level. There, I don't know, perhaps Kai, you could answer that.
Sure, thank you very much, Andreas. And I think first of all, also just to mention that some participants may not know all of our other tools that we have developed around infodemic management. We have very systematic and step-by-step processes developed, in particular on generating infodemic insights reports, also a lot of training modules, competency frameworks, etc., that are all available on our website. And of course, also that that if you reach out to us, we can share separately. So we are really advancing kind of the work on standardized approaches for social listening more broadly as part of infodemic management. And there, for example, we are also working on an information environment assessment tool that was piloted earlier this year in Sri Lanka and Thailand. And I think for this guidance, we want to take a similar approach. We want to, this is already a very practical guidance, and it has some accompanying tools, but now we want to really use a co-design approach in applying them and piloting them in countries. And so we are really looking at national authorities, but also other stakeholders to work with us on implementing this, to identify the training methodologies on it, and then really gather real-world feedback on how relevant it is and improving the user friendliness. So we are working on refining the tool and developing a training package on that. Then, based on the lessons from the development, pilot it in 1 or 2 countries, depending, of course, on many contextual factors, including also our capacities. And then, hopefully, if there is sufficient resource available, roll this out, focusing on countries with the highest interest and also the biggest need. And of course, all of this we do in particular together with our WHO regional and country offices, with the aim to really integrate this into national planning processes for WHO, but also for the member states. So we are very open to collaboration on this. And if there's interest in your setting, we'll be very happy to explore how we can collaborate with you on this. Back to you, Andreas.
Thank you, Kai. And I think we have time for one more question. Maybe this could be for Professor Andorno. In some countries, social participation regulations require that social listening be conducted exclusively with authorities and formal institutions, which makes it challenging to work directly with communities. So from an ethical perspective, how can we navigate these tensions between what is institutionally allowed and what is ethically necessary for an inclusive and effective response?
Yeah, thank you, Andreas. And it seems that my line is a bit compromised. I apologize for any connectivity problems here. I think it's a great question. It seems to me that if there are legal restrictions in place that prevent you from directly reaching out to communities in that very countries, I would assume you have to accept that. But of course, in social media, the discourse is not necessarily structured along nationality. So there you could definitely reach out to an international community and also reach out to citizens from a specific state if you're interested in that. And I think, and that's the point I would like to make, is I think it's an excellent opportunity to work with governments and authorities invoking the guidance documents, because there's so many good reasons in there explaining governments and authorities what such a strategy should look like to ensure you can in the future really work together to build ways of responsibly conducting social listening as one element of infodemic management. Thank you.
Thank you very much, Nicola. And I think with this, we'll have to turn it back to Kai. Thank you.
Yes, thank you very much, Andreas, and also thanks to everyone for the great questions and the participation in the dialogue in the Q&A. I think those questions we were not able to answer now, we will try to answer in writing afterwards. Now, and now for the closing of today's session, I'm honored to invite Dr. John Reeder, Director of the Special Program for Research and Training in Tropical Diseases, to share his reflections. Dr. John Reeder, over to you.
Thanks very much, Kai, and thanks to all of the speakers for a really stimulating webinar. And of course, all of those who've worked on this initiative over the last year or so. Ethical frameworks like this are so important in getting that balance between data-driven decision-making and having the need for transparency and accountability and public engagement. We really hope that this document will guide ministries of health and other actors in conducting social listening activities in an ethical manner. WHO will work with national ethics committees and infodemic management programs to disseminate this guidance, but we can't implement it at all. Governments, health organizations, and tech platforms really must collaborate to ensure that implementation of ethical and effective social listening for infodemic management happens. Investing in training and capacity building is also necessary for ethical implementation, and we're planning to develop an online training course based on this guidance document, but we really encourage people to join with us in making sure that adequate training is available. And finally, and I'll keep it short because of the time, and perhaps most importantly, civil society plays a key role in this area. There's a real need for open discussion with the public about data use to enhance trust, not bring it back down. This is a problem of trust, and we must start from our point of view of enhancing that trust and getting acceptance in public health measures and in science more broadly. So given the time, I'll leave it there and pass back to you, Kai. Thanks a lot to everybody.
Thank you so much, Dr. Reeder, and thank you again to all our speakers and participants. I want to take the opportunity to thank all our collaborators, especially Dr. Andreas Reis, Dr. Reeder from the Science Division, and the 19 expert group members who brought their diverse perspectives to this complex topic in the development of the guidance, but also today in this event. And as Dr. Rita mentioned, we see this guidance as a starting point. It's not the final word. We look forward to supporting countries and partners to adapt and apply these principles in real-world settings. So please stay connected with WHO and our partners as we continue to promote ethical and effective infodemic management. The guidance document is available on the WHO website, and we invite you to share it with your colleagues and networks. And the recording of this session will be made available shortly as well. Okay, thank you very much, everyone, and take care and goodbye.